Welcome back, everybody, to another episode of Explain This. This is our brand new content series with the star of the show, Robin Riddle.
Hello.
Robin, how are you?
Doing well. How are you?
I am, as always, excited to be here. I'm in the Knoxville office with you. And guys, Explain This is just about, we're going to do a little deep dive into certain topics, ideas, anything that you might hear from Robin or one of our other providers in a office setting. And today's topic is WEGOVY. Robin,
WEGOVY.
Explain this.
WEGOVY is the new FDA-approved weight loss drug that has just come out onto the market, and we are so pumped about it. So it was created from an older drug called Ozempic that was originally developed for type 2 diabetes. It's been on the market since 2017, so it's not a brand new drug. Using the Ozempic for type 2 diabetics, we started noticing that people were losing a lot of weight with it, which is awesome because usually type 2 diabetics need to. So they took that drug, researched it to higher doses, and we now have WEGOVY. So WEGOVY is the first and only of its class. It's called a GLP-1 receptor agonist. First one of its class, approved for weight loss in a once-weekly injection. Comes in a little pin form like this. You pop the top off, stick it to the back of the arm, stomach, or thigh, and that is your dose for the week. It works by doing a couple of different things. One, it's addressing one of the most common reasons for weight gain, which is insulin resistance. Okay. So it's addressing that underlying cause. It works by suppressing the appetite. So it suppresses the hunger hormone. You don't feel hungry as often. Slows gastric emptying, so your stomach stays full for longer, so you don't feel as hungry. And then it almost has a negative feedback if you eat cruddy foods, fried stuff, junk food, high sugar, high carb, it makes you feel bad. So it works in that way as well. Common side effects of the WEGOVY definitely causes some nausea is a pretty normal side effect that comes along with it. Most people, it's very tolerable. They get through it. Sometimes we need to do some Zofran, but usually not even that. But in the research, they're seeing between 15 to 20% of total body weight lost.
What does that mean? 20% of total body weight loss, meaning if I lose, if I'm 200 pounds, on average, I lose 20% of that or 15% of that?
Yeah.
That's wild. Now, when you talk to patients, how long can they expect to stay on something like WEGOVY?
So everybody's different. The research was done over 62, 63 weeks. So it definitely is a longer term thing. It's not like you take this for a month or two.
I can't even do the math of that. 62 weeks.
over a year. It's over a year. It is something that we can titrate off of when we get to the point of wanting to, but it definitely is a more long-term thing. Some people see weight loss even within the first couple of weeks on it, but to produce the ultimate weight loss, which is that 15 to 20%, we're looking at diet, lifestyle changes, and WEGOVY more long-term.
So how do you combine those three, diet, these lifestyle changes you're talking about, plus a medication? And as a provider, are you cool with them being on a medication for that long? Is that something you're cool with?
Yes, because that's the way that this was researched. That's the way that this drug is supposed to work. Ultimately, being a functional medicine provider, I love to get people off of all medications unless it's something that absolutely is needed. In this case, and in another episode, we'll dive more into insulin resistance, but the effects of carrying that extra weight and of insulin resistance on your body are so bad that I would rather do a medication that's going to have a few side effects. You get used to them. Like I said, the nausea is the biggest one. I would rather do that and get the weight off than have people just kind of fight this uphill battle trying to lose this weight that they're really struggling with for years on end and do more damage to their body with other disease processes.
Totally.
Yeah.
Now, one thing, before we end here, do you know anything about cost, anything that you're telling patients to expect from the insurance companies?
So it's if your insurance already has coverage for things like Saxenda, which is another weight loss drug, then your insurance is going to cover this. So that's something patients can always check on their own. Right now, the manufacturer has a rebate card, and so you can get the drug for $25 a month for 6 months on any commercial insurance. After that 6-month mark, we don't necessarily know what insurance is going to do at that point. But at this point, I'm telling people 6 months on this is better than nothing.
Yep.
And then we'll fight that battle when we get to it with the insurance. Now, unfortunately, it is a very expensive drug. So without insurance, it's around $1,200 to $1,300 a month.
Wow.
Yeah, it's very expensive right now. So for patients that don't have insurance, we definitely have less expensive options. But for insurance patients that are really struggling to lose weight, this is a great option. So anybody with a BMI over 30 or over 27 with other health conditions like high blood pressure, things like that, they're a great candidate for this.
That is amazing. I'm excited about WEGOVY.
Me too.
Robin, thank you so much for explaining this. Guys, this has been Explain This, WEGOVY.
Don't go away.